it also contains, if you believe that there has been unfairness in the criminal justice system, it has baked in systemic violence or systemic disparities, because some demographics have been treated differently statistically in our system. I mean, we know, our office knows right now that you are 7 times more likely to be incarcerated in this county if you're African American than if you're Caucasian. We know that. That's just the truth. And say to people when we're talking about those kinds of things is I sort of have a little problem. I ask. I said, okay, I'm going to tell you right now, 30 minutes from now, the sheriff's kind of coming and going to arrest you. Don't run away. That's a bad idea. You can give your wallet and your watch and your purse or whatever else you have to me, but you're going into jail, okay? And you're going to get a good deal. They'll eventually give you a misdemeanor, and you're only going to do 45 days or 90 days. So it's not going to be that bad. What would that mean for all of our lives? A lot of us wouldn't have jobs. A lot of us wouldn't have spouses. A lot of us would certainly not have housing. That's what it does. And so it's not just riskless. There's countervailing things we need to think about.
Sir, the public defender also has ongoing programs, pretrial programs, and we're not proposing to change those. So the growth request, one of the differences between the so-called growth request for the public defender and the growth request for probation is that the growth request for probation really isn't anything new, it's just continuation, whereas the growth request for the public defender is an enhancement to those programs.
So our program goes in, and it took some time, but we've now negotiated. We get the list of the people in the jail, and we go over and talk with them. And we talk with them with social workers and or law students and or social worker interns. With the social workers we have, we're able to use a bit of a force multiplier, and we've done that they can supervise social worker interns because they're sufficiently degreed that they can do that. And turns out we're a pretty desirable place for a lot of social worker interns to want to volunteer at. And so we have a fair number of them. We can't supervise an infinite number, but we do have them who come. So we talk with them, and we've developed screeners, as we call it, and I don't know why we called it that, but screening tools, and they're evidence-based. And you're probably familiar with one of the ACEs study, the Adverse Childhood Experiences. That's one. That's very quick. We also do a mental health screener, and we do a screener for need for AOD, alcohol and drug things. We screen for their needs. That's what our program is, screening for what the needs are, and then we try to provide linkages to the services that those needs are disclosed. That's what we're doing, and that's why it's different. Probation is providing a risk assessment, and the court, and they have a statistically valid tool, or at least scientifically valid tool with its own issues, but it's a valid tool. And the courts have to talk to you about what they think of it. But we're actually looking at what are your needs, well, how can we try to meet them, and how do we try to meet them by linking to services that exist in this county? That's with it. But we're basically finding that half the people we talk to, we get out. This is Tiffany Stinnett. She's the supervising attorney in the public defender's office.
So we're seeing about 15 a day, 300 a month.
Okay.
We get a booking list from the jail every morning at 3 a.m. of everybody that was arrested the day before. We take that booking list, we look at it. We usually don't interview people that are charged with homicides, right? And we look at it to get a list of who should be interviewed that day. Roughly, we see about 30 people on that list that we really need to get to. Our goal is to get to 30 people, not just 15 people. So everybody in that jail can be assessed. The 4 assessments is a mental health assessment, a substance use assessment, a housing assessment to assess for homelessness, and the trauma assessment. We then go and interview people. We put it together in a packet. We give it to the attorney. We staff with the attorney. The attorney then goes to court. They meet with the judge. They meet with the DA. And they say, hey, we talked to these people, and these people have or need linkage to mental health. they need linkage to substance use, or they have a job and they've got 5 kids sitting at home and we need to release them today. The judge then listens to all that information. The judge will then just go ahead and release somebody, or the judge may say, look, I want your social workers to follow up on this case. Let's see if we can get them linked to services, and let's see if we can have a coordinated discharge, because what's happening now is not a coordinated discharge, right? People get released in the middle of the night from the jail, and then they become victim or they victimize others. And so what we're trying to do is stop that. We're trying to stop that recycle into the jail. And so the hope is that if we have that social worker that can work as a catalyst behind the scenes, because you've got the criminal justice system, which is this huge beast of itself, right? And you've got all these great resources in our county, but we have a gap trying to get the two to work together. That's where our office comes in. That's where our social workers come in. You can have this assessment done under the attorney-client umbrella, and then what you have is an opportunity for the client to be connected and to say to the judge, Judge, we have Shelter Inc. down the street. We will have a bed available for this individual tomorrow at 10 a.m. How about instead of releasing right now, we wait till tomorrow at 10 a.m. We have the social worker there, warm handoff. We walk them over to Shelter Inc. and make sure they get in. That's what this program does. That's why this is so different than we've ever done in this county.
The other thing I would say is that our program really is aligning well with county values, especially enunciated by this board. This board has a resolution about racism as a public health crisis. This is designed to track that, deal with it, try and respond to it, and be responsive in that area. What probation is basically doing, as I understand it, and I don't want to speak for him, but this is how I understand their program, they take a computer data of each person who is going to be on for arraignment, and they run them through the computer and give you a risk assessment based upon their record. So with that said, they do that and they provide that risk assessment to the court. And then the court looks at it and does what they're going to do with it. And court says, as I'm sure you all know, they do what they want. And they don't necessarily, it depends on the judge, what you're going to get. And then after that, if the judge releases them on various levels, I believe they have 5 levels, and Marlon can talk more about that, but the highest is GPS, and there's always a bias and respectfully to the courts, there's always a bias in, I want to have the highest level of supervision, because if anything goes wrong, I want to make sure that's what I asked for. If you're a judge, that's what they worry about. And law enforcement worries about that, and I understand that, but that's just the nature of the criminal justice system we live in, and it isn't fair because it doesn't consider an important consideration. When we over-incarcerate, we're also harming our community. If you under-incarcerate, you can argue you're harming our community, but when we over-incarcerate and we do damage and trauma to members of the community who didn't need to be locked up, that's harming our community too. So it isn't just let's do the riskless thing and keep someone in. When we keep someone in we shouldn't, we are harming our community. We are traumatizing families. We are making I can provide studies if you want to see them that shows that over-incarceration or unnecessary pretrial incarceration makes us less safe. And we can argue about the study, but I can show you some studies that say that because it breaks up the contact that people have, the connections they have, the jobs, the family, the relationships they have, and when they get out, they're out. The financial potential benefits, I heard Supervisor Cern, I think, talking about what's the investment on that. What would that be? Well, I would say that if we were able to get 20 people out a week, we are now that will turn into approximately $440,000, assuming $185 a day, which is a fair assumption of what it costs in there. We can get debates. Is it 125? Is it 220? Is it counting psychiatric services or not? That kind of thing. So that it can pay for itself pretty quickly. And, you know, our program, I mean, it's been humbling to see the grassroots support and the people calling us and what are you doing? How are you doing that? We want to work with you. We want to help you. I mean, that's kind of surprising for us. And it has grassroots support. And I think that you know, that's something to be considered. Our screeners are showing this right now. About 70% of the people we talk to say, I want social work help. I wrote them down because they change over time, but they've been relatively consistent. 48% are reporting they have some mental health issues. 37% alcohol and drug, and these are, some people report in more than one domain. That's why we're going to have more than 70% here. 43% of homeless issues, although that varies dramatically by the time of the year. Mm-hmm. When it's warm, not so many people report having homeless issues. When it's cold, they start reporting it. And our social work caseload, we have 2, is pretty much is filled right now. They're at over 200 cases for the 2 social workers they're carrying right now. And as they get warm handoffs, some come on, but they have a full caseload going on right now. The other benefits I want to talk about, and these are harder for us to quantify, but we really do believe they're there. One, because we're now pushing to get people out at the first opportunity rather than the way it would normally go. You're arraigned, come back in 2 days, or now with COVID, a week, and then we'll see about a bail hearing then. We're pushing hard to get them out now. When we get them out now, that saves time right then. 2, the screeners that we're doing provide information that our lawyers are using to negotiate alternative resolutions, and earlier in the case where people get out of jail or they get linked to a collaborative court or a rehab facility and those kinds of things. So that's what we're doing with that. And I understand that our expungement request is also before, and I want to at least address that briefly. That's a little under $600,000 for a couple lawyers, a legal secretary, and some other additional help. That's what we asked for there. And you know, the demand is high for that. The studies show that it reduces recidivism, it increases earning potential when you can do that. We are, I don't know if it's daily, but I know many times a week. Let's see if it's daily. If it's daily that we get calls and saying, can you check on warrants for this person so we can get them into housing? Can you clear up warrants for this person? And I think it's daily that we do that right now. Yeah, right. Multiple times a day we're doing that right now. And this builds on that. So when we can expunge someone's record, then they can qualify for housing they don't otherwise qualify for. When we can expunge their record, it's the difference between being able to afford an apartment and health insurance and being on, not being able to afford that. 20%'s a lot, and I've seen as high as 30%, but it opens up doors that don't otherwise open, and it particularly opens up doors in our communities of color that have been most harmed by or have the greatest need for this. And so certainly we would appreciate that as well. I think, close with saying that our request on the pretrial is important, designed to be modest. It's 3 FTEs. It's 2 social workers and a legal secretary. And then it's some other money for basically law students so we can have some consistency in how we do that, and $125,000 so we can contract with the community to participate. And I do want to say something about our track record in participating with the community. There were a couple of large-scale releases from the jail where, because of COVID, where we cooperated, and the sheriff, I want to thank Sheriff Jones for working with us on that, to have volunteers meeting people at prearranged time that the sheriff worked with us on, to meet them at the jail so they're just not coming out and stumbling out and wandering around. And we had them met with food, phone, water, blankets, connection to services, information. We had people out there, my lawyers, out of their own pockets, bought food and blankets and water and provided that, and so the community. The community did that, and they really stepped up and did it. And it's an example of how interested your community is in wanting to help with this problem.
Since August, we've seen 1,000 people, approximately. Of those, 83% are male, 17% female. 41% are African American or Black, 31% Caucasian, 16% Hispanic, 7% Asian, 3% other. As Steve said, of those 1,000, 48% need mental health support, 37% need AOD support, 43% needed housing support. What's fascinating is 70 to 80% of everybody we see needs some sort of social worker follow-up.
Okay.
Whether that's calling the jail because they were too afraid to tell the sheriffs that they're on meds, but they'll tell us they're on meds, so we can call the sheriff and say, hey, jail psych services, we need this individual looked at, he needs his Risperdal, so he doesn't decompensate in the jail, right? So that follow-up can be linkage and connection to services, but it's also support within the criminal justice system as well, so that the judge and the DA has a full picture. Probation has a PSA tool that uses rap sheet, but the rap sheet won't tell you if somebody's mentally ill. A rap sheet won't tell you if they've got 5 kids at home. That's the information judges and DAs need to make the decisions they have to make.